Hello, everybody. My name is Marcos Ramirez. I'll be I'll be presenting this presentation on hepatitis C, also known as HCV, which is a disease that has been involved in the liver, and we'll be discussing about that in this presentation. So, the learning objectives. By the end of the presentation, you will understand how hepatitis C was discovered and how it has impacted health worldwide. You will learn about the current challenges in managing hepatitis C, including efforts to improve treatments and increase access to care. Finally, you will be able to identify strategies that are being used to try to stop the spread of the virus, both in the United States and globally. The historic overview of hepatitis C. So on this slide, we discover an early research. The hepatitis C virus was first identified in 1989, previously known as non-A, non-B hepatitis. This breakthrough was pivotal for improving the safety of blood transfusions. Epidemiological trends. By the early 1990s, hepatitis C was recognized as a major cause of chronic liver disease globally and the first specific blood test for HCV, greatly enhanced diagnosis and monitoring. Advancements in treatment. Early treatments included interferon with ribavirin added in the early 2000s, improving outcomes. The 2010s saw a major breakthrough with the reduction of direct-acting antivirals, which significantly improved cure rates and reduced side effects. Current challenges and progress. Despite advancements in treatment, challenges remain ensuring globally access to these therapies, diagnosing undiagnosed cases, and addressing high-risk populations. The World Health Organization aims to eradicate hepatitis C as a public health threat by 2030. On this slide, we'll be talking about economic and health impacts of hepatitis C in the United States. When it comes to financial costs, hepatitis C costs the U.S. healthcare system over $600 million annually in handling both acute and chronic cases. Over the decade from 2010 to 2019, it's estimated that hepatitis C will cost a total of $184 billion, highlighting its significant financial impact on the healthcare system. Public health challenges. There is an increasing number of hepatitis C cases among young adults, including those of reproductive age, placing multiple generations at risk for developing chronic hepatitis C. The number of newly reported chronic hepatitis C infections in 2018 was similar across both younger and older adult populations. The CDC now recommends hepatitis C screening for all adults and pregnant women, expanding beyond the previous recommendations that focus primarily on individuals born between 1945 and 1965. and those with specific risk factors. When it comes to this slide, trends and impact of acute hepatitis C in the US from 2009 to 2018, annual reports and estimates. In 2018, doctors reported 3,621 cases of acute hepatitis C. However, the estimated true number of cases is much higher, possibly around 50,300. This big difference suggests that many cases go unreported. Range of estimates. The number of estimated cases ranges from 39,800 to 171,600, indicating a lot of uncertainty about the exact number of people affected. Increase over time. The rate of acute hepatitis C reported per 100,000 people has increased 3 times from 0.3 in 2009 to 1.2 in 2018. Who is most affected? In 2018, the highest rates of hepatitis C were found among young adults. People aged 20 to 29 years had an infection rate of 3.1 per 100,000, and those aged 30 to 39 years had a rate of 2.6 per 100,000. So, when it comes to this slide, strategies to reduce hepatitis C transmission, key prevention and control measures, expand hepatitis C prevention programs. We need programs at local, national, regional, and global levels. These programs should ensure that all blood and related products are free from hepatitis C. Safe injection practices should be followed in medical settings and elsewhere. Screening recommendations by the CDC. The CDC now advises that all adults should be screened for hepatitis C at least once in their lifetime, and that pregnant women be screened during every pregnancy. This is to address the growing issue of hepatitis C in the US. Preventive practices in the absence of a vaccine. Since there is no effective vaccine for hepatitis C, avoiding the virus is crucial. Extra care is necessary in healthcare settings and for people at higher risk, such as those who inject drugs, men who have sex with men, and those living with HIV. Preventive measures, including using healthcare injections safely, properly disposal of needles, services for drug users like needle exchange programs, testing out donated blood, training health workers, and practicing safe sex with barriers like condoms. And that will be the rest of this presentation on the disease on hepatitis C. These are my references. Thank you for watching.